will potentially look like after this Dobbs decision from the Supreme Court. I hope that we can get to your questions, all of your questions. The panel discussion tonight will be in 3 segments. There will be an introduction and presentations, and then our moderator will ask the panelists questions, and then we will take questions directly from the audience. Without further ado, I'm State Senator Barbara Favola. I represent District 31, which is currently portions of Arlington, Fairfax, and Loudoun, soon to be all of Arlington under the new redistricting plan. I'd like to take a moment to introduce our moderator, Adele McClure. Adele is the executive director of the Legislative Black Caucus. She has had lots of experience in drafting legislation and being an advocate and basically getting things done, moving the needle on a good progressive agenda. And Adele is also running for the 2nd delegate district right here in Arlington. Adele, we are so happy to have you, and I will turn the program over to you.
Thank you, Senator Favola, and I'll be kicking it back over to you. But first, I want to give the audience a little bit of background about yourself. And before I hop into that, remind the audience to please put your questions and answers questions into the chat or the Q&A box throughout the program. And then at the end, we're going to reserve some time for Q&A. So feel free to just drop a question whenever you have it, and then we'll be monitoring the chat, and then we'll make sure to ask the panelists those questions at the end. So throughout her public life, Senator Favola has been a vigorous supporter of universal human rights. In the Virginia Senate, Barbara is focusing her legislative efforts on women's reproductive rights, healthcare access, K-12 education funding, workforce training, safety net programs, helping foster children, preventing domestic violence, and putting forward sensible environmental policies. So Senator Favola is a whip in the Virginia Senate Democratic Caucus. She chairs the Virginia Senate's Rehabilitation and Social Services Committee, and she is a member and former chair of the Virginia's Advisory Committee on Sexual Assault and Domestic Violence. So she's done a ton. She also, prior to her election as a state senator, served on the Arlington County Board for 14 years and chaired the body 3 times. So we truly appreciate all that you've done for Arlington and throughout the Commonwealth, and kicking it back over to you for your presentation.
Oh my goodness. Thank you, Adele. Well, I guess there are 2 important messages that will frame the backdrop of our conversation. The first message is the Supreme Court decision on Dobbs essentially removed a constitutionally protected right to access abortion care through the 2nd trimester. And that right was argued on the basis of personal privacy. But now that decision has eroded a nearly 50-year precedent and turned it over to the states and said, okay, states, you can now regulate access to abortion care. And this is a really important factor in the lives of women across the United States. And I can go into detail on Virginia's laws, and I could go into some detail, not a lot, about the laws of the states surrounding the Commonwealth. But you need to know that now your advocacy, your interest, and your access all evolve around locally elected officials. Before I turn the platform back to Adele, I will say that access to abortion care through the 2nd trimester is legal in Virginia. We did codify that, and we also removed some barriers to accessing care when the Democrats were in control of the House of Delegates and the Senate, and Governor Northam was our governor. But this is done, again, through legislation and can certainly change depending on elections. We have a 1-vote Democratic margin in the state Senate, and the House of Delegates is 48 Democrats and 52 Republicans, so it is in Republican control. So now I will turn it back to Adele so she can introduce other panelists and they can go into more detail.
Thank you, Senator
Thank you.
Favola. Really appreciate
Thank
that. And next up, we have Delegate Rip Sullivan. Welcome, Delegate. Before being elected to the House of Delegates in 2014, Delegate Rip Sullivan served our region on numerous boards and commissions, providing him with an extensive experience in a number of key policy areas that directly translated to his work for the 48th District. And Rip also served as chair of the House Democratic Caucus to promote the goals of House Democrats. And as delegate, Rip has fought every single year to encourage the growth of Virginia's clean energy and energy efficiency sectors, promote access to the ballot box, protect and advance LGBTQIA+ rights, and depoliticize the redistricting process, in addition to working to protect reproductive health rights of folks in Virginia. So turning it over to Delegate Rip Sullivan.
Thank you, Adele. It's very nice to be with you all. My apologies for taking so long to get on, but I'm glad I finally did. It's nice to be with you. Obviously, the Dobbs decision, since it had been leaked, was not a big surprise, but that doesn't make it any less devastating. As Barbara said, it really does turn the law on its head that we've all been living under for the last 50 years. The returns to the states is the way the Supreme Court looks at it. These decisions and has resulted in now this patchwork of an ever-changing patchwork of what's going to be available to women in terms of reproductive care in the various states. And Virginia now occupies a position as a sanctuary state. Numbers are up all across Virginia at our women's clinics, with women coming from other states that are more restrictive than Virginia. From a straight political perspective, and Barbara was getting at this point, your advocacy is now magnified. The importance of your advocacy is now magnified because Virginia, while it is now a sanctuary state, will be at the epicenter of the evolving debate and the evolving trend, if you will, of states passing more and more restrictive abortion regulations, if not outright bans, because our governor and the Republican side of our state legislature, in both the House and the Senate, have made very clear that they want to change the rules in Virginia and make it, if not an outright ban, something else. Take away the progress that Barbara mentioned in her opening remarks. And while we were worried they were going to try this as recently as yesterday, when the General Assembly was in Richmond for a special session, they did not. But we should not take any comfort from that fact. It's very clear that when we reconvene in Richmond in just a few short months, this will be top of the governor's and his Republican colleagues in the General Assembly, top of their agenda. So we need to just make enormously and abundantly clear to them how misguided a strategy that would be. And that involves advocacy from folks on this call. This issue did come up yesterday. Candidly, I don't know whether it did in the Senate, but it did in the House. There were a couple of impassioned speeches. Delegate Sia Price gave a terrific speech, and then the Republicans pushed back immediately. Delegate Elizabeth Brewer gave a speech, which really just put in stark relief the strategy on the other side to say anything they want to twist facts, twist our position in any way they want to in order to scare people. And mostly it revolves around this issue of abortion up to and including at a live birth. And we can get into all this, and I hope we will as the evening goes on. But that's the scare tactic that they're using, and they came up again on the House floor yesterday. That the abortion rights movement, the women's reproductive rights movement, is so extreme as to allow abortion upon birth, infanticide, of course, they call it, all of which, of course, is ridiculous. But they're all too willing to say that in order to justify their position. So I hate to be the downer here, but it's a huge challenge. And Virginia is really on the knife's edge. And events like this and more to come. There was a terrific rally in Richmond yesterday that we all attended. And events like this, educational events, so that people can understand exactly what's going on, both from a medical and a political perspective, are really going to be very important over the next couple of months. And I just want to thank you folks for being here tonight, because the Dobbs decision, you can use all sorts of words to describe it, but it is just calamitous. And we need to fight back. And I'm glad to be on this panel with a bunch of people who are going to be doing that. And I'm hoping that the folks watching us are going to either continue their efforts, or join those efforts.
Absolutely.
Thanks, Adele.
Yeah, thank you, Delegate. Next up, we have Dr. Aimee Danielson, who is the founder and director of the Women's Mental Health Program at the Medstar Georgetown University Hospital. She is a clinical psychologist and associate professor of psychiatry and obstetrics and gynecology in the Georgetown School of Medicine. She has worked exclusively in the field of perinatal mental health since creating her own postdoctoral fellowship in the area since 2002. And since that time, she has developed and implemented numerous clinical, academic, and research programs to respond to the unmet mental health needs of perinatal women. So she founded the Women's Mental Health Program at Medstar Georgetown University Hospital in response to a critical need for specialized care at this institution and in the region. And so she has done a ton, and over the past several years, she has led numerous efforts centrally focusing on expanding perinatal mental health services in the District of Columbia. And we're so excited to have you here, and I'm passing it over to you for a few remarks.
Thank you very much, Adele, and thank you, Senator Favola and Delegate Sullivan, for the opportunity to take part in this conversation, which I believe is one of the most important issues of our time. And I think before I start, I wanted to also say that I'm a mother of 3 girls. I've spent most of my life living in Virginia. I grew up in this part of Virginia. My family lives here. I went to college here, and I've chosen to raise my daughters here. I'm also a clinical perinatal psychologist, and I've spent over 20 years working with women. Most of those women have either been pregnant or newly postpartum, and many have grappled with complex issues related to reproductive decision-making following unwanted or unintended pregnancies, life-threatening pregnancies, wanted pregnancies that resulted in a devastating fetal diagnosis, and difficult reproductive choices involving fertility treatment. I've personally observed many far-reaching negative impacts of wanted and unwanted pregnancy on a woman's physical health, her mental health, her intimate relationships, the attachment to and connection with her baby, as well as parenting behaviors and attitudes towards her children. And as we've heard, the Dobbs ruling denies legal precedent, but it also denies science. And today I'm hoping that we can talk a little bit about the ways in which this ruling ignores the science on reproductive health, as well as mental health, domestic violence, and economic outcomes associated with denied abortion. There is about 50 years of international psychological research that debunks numerous myths that are often cited to justify restrictive legislation that suggests that chosen abortion leads to devastating mental health outcomes like depression, addiction, and suicide. It also fails to recognize that women that are denied abortions are not the only ones harmed. Children born as a result of denied abortion are more likely to live in poverty, experience poor bonding with their mothers, and are at an elevated risk for a range of social, emotional, mental health problems that persist into adulthood. We know that having an abortion is not linked to mental health problems. What's harmful is the stigma surrounding abortion, the lack of knowledge about it, the lack of access to safe legal abortion, resulting in forced pregnancies. And what we know is that these negative outcomes are not limited to minor problems that occur over a short span of time. I agree, we must support a woman's right to choose whether or not she has a child. Laws that limit contraception and abortion, that permit forced interventions during pregnancy, and the criminalization of personal behavior of pregnant women are just demeaning to women, full stop. They're based on a premise that women do not understand their condition when pregnant, that they're unable to make considered decisions about their pregnancies, and that their lives are less important than those of embryos. And tonight, I hope that we can discuss the science that tells us these premises are faulty. Thank you.
Thank you, Dr. Danielson. Truly appreciate that information, and definitely want to dive deeper into that later in the conversation. And if you all have questions in the audience, please drop it in the chat or the Q&A portion, and we'll make sure to get to that at the end of the segment. The next panelist we have is Aimee Lockhart. She serves as the Executive Director of Planned Parenthood Advocates of Virginia, a statewide advocacy organization whose mission is to preserve and broaden access to reproductive health care through legislation, public education, electoral activity, and litigation in the Commonwealth of Virginia. Previously, Aimee served as the National Director of Mission Readiness, was recruited for campaigns in Commonwealth of Virginia, including President Obama's 2012 re-election, and served as a legislative assistant and director of communications for Congresswoman Diana Delegate. And Aimee graduated magna cum laude from James Madison University and obtained a Master in Public Administration degree from Harvard Kennedy School. She is a certified group fitness instructor, triathlete, and mom to a toddler. So happy to have you on, Aimee, and thank you for all the advocacy that you've done here in the Commonwealth of Virginia, and I'm passing it over to you.
Yeah, thank you so much, Adele, and thank you, Senator Favola and Delegate Sullivan. I can be a visual learner at times, so I thought I would put together a slideshow to help talk through the portion that I'm presenting on today, mostly wanting to focus on some of what Senator Favola covered, but what Virginia looks like in a post-Roe world. So as was mentioned, I'm with Planned Parenthood Advocates of Virginia, a statewide advocacy organization. We're a C4 social welfare organization. And I work with 3 different Planned Parenthood affiliates. So there's 6 Planned Parenthood health centers in Virginia, hopefully even more in the future, but also work with the health center in Washington, D.C. and some in Montgomery County and in Maryland. So the state of abortion access, as was mentioned, the Dobbs decision really brought back the access, protection for abortion to states and states to decide. So nationally, and I'm going to show a map in a moment, we've seen a number of attacks in states across the country, but we've also seen national attacks on abortion. And so I think it's also important to remember that, you know, we have President Biden in the White House now, who is doing everything with his administration to protect abortion access, but that's not, you know, guaranteed long term. And then here in Virginia, as was mentioned, abortion is legal. We also have a number of protections from the Reproductive Health Protection Act that passed in 2010. And so pre-July 2020, we had a number of restrictions like a mandatory waiting period, mandatory ultrasound, bias counseling, and things that were thankfully repealed so that those seeking abortion care in Virginia don't have to go through a number of onerous restrictions before accessing care. But we know that there are efforts to ban abortion here in the Commonwealth. And so want to talk a little bit about what the national map looks like right now and how important Virginia is to this map and to access. As you can see, most of the South and Midwest has abortion bans in effect today. And then we have a number of states around us that are in very precarious positions. West Virginia legislators are deciding right now what they're going to do about banning abortion. South Carolina, as folks might have seen in the news right now, is currently considering a total abortion ban. There, they have a 6-week ban that's temporarily being halted in the courts. Georgia has a 6-week ban. And then Florida and North Carolina both have pre-viability bans in effect. And North Carolina, a lot is dependent on their election this November. So I know that we are seeing increased volume of folks coming to Virginia to access care, but we're not seeing as many as could be coming to Virginia because North Carolina still has a lot of access protected, but that could very much change. So a little bit more on what the decision means for Virginia. As Senator Favola mentioned, abortion is legal in the first and second trimesters here in the Commonwealth of Virginia. But the future of abortion rights just depends on who we have in Richmond representing us. We are one state Senate seat away from an abortion ban getting to Governor Youngkin's desk. During the last legislative session, we saw attempts to ban abortion. We saw a number of attempts to add new restrictions or to reinstate those restrictions that were repealed a couple of years ago. And those were blocked by Senate Democrats, and House Democrats were united in opposing those. So the attacks that we're anticipating here. So Governor Youngkin on June 24th, once the Supreme Court announced the decision to overturn Roe v. Wade, announced his support for an abortion ban. He has tapped 2 senators and 2 delegates to lead this effort, and they said that they will come prepared in January with a bill for the legislature to consider. And as was mentioned too, we thought there were rumors that he was going to send down an abortion ban yesterday during the special session, but thankfully, and I think to the credit of those that support abortion rights, that didn't happen. And then there are also bills to ban abortion at conception. So there's Senator Hackworth and Delegate March both have bills they've talked about. We also know that other abortion restrictions are likely to be introduced, and that there's also even been a push for Governor Youngkin to take executive action, which I don't think he has the ability to take, but folks have even suggested that he do so. And so we're preparing for all of these attacks. And one thing I want to just say about kind of how what was said on the House floor yesterday and what Republicans are going to say about trying to find a compromise or trying to figure out like what is a reasonable ban. And I think we know that any abortion ban is extreme because any abortion ban takes the ability of people to make decisions about their bodies, their lives, and their futures away from them and puts it in the hands of legislators, where those decisions should be between a pregnant person, their family, their faith, and their medical providers, not a decision to be arbitrarily have a cutoff point when we know that pregnancy is really complicated and there are complications for maternal health, but also for the status of the pregnancy. And so really needing physicians, clinicians to have the ability to make those decisions and to do what is best for their patients. We know that abortion is a very personal decision and sometimes very complex. And that we also know that support for abortion rights is very high. The recent Roanoke College polling shows that the vast majority of Virginians want to see abortion rights protected. Only 10% of Virginians want to see abortion banned. And then I just have a little bit of information about what Virginians can do around spreading awareness, taking action, joining Planned Parenthood Advocates of Virginia's Rapid Response Team, donating funds to organizations like ours or local abortion funds, and happy to answer questions too. Thanks, Adele.
Let me just say, Adele, I didn't think I could ever be more impressed by Aimee Lockhart, but I just learned she's a triathlete as well. It's just unbelievable.
Triathlete.
Thank you, Aimee, for all you do.
Absolutely. Let me just interject something. Patrick Hope very much wanted to be part of this panel. He was looking forward to it. He helped promote this panel, and he's a really strong advocate for access to safe and legal abortion. He's been a big part of our whole reproductive justice effort. And however, and I will take responsibility for this, we made it pretty complicated to become a panelist in an effort to ensure security and have some control over the Zoom world. We made it complicated, and something went awry, and Patrick is now no longer able on any of his emails to access the program. So we miss you, Patrick, but thank you. I know you're with us in spirit. And if you can, at a later time during the program, get into the participant pool, we'll be able to move you up as a panelist. But I just wanted to make that announcement.
Yeah, thank you, Senator Favola. And if any of you in the audience have any direct questions for Delegate Patrick Hope, we can send you that information to email his office or to reach out to his office directly. So next, we're going to jump right into the discussion. And Jamie already did a high-level overview, but wondering if you can jump into a little more detail, Jamie, about clarifying what the current laws are in Virginia on abortion. And then I'm going to kick it over to legislators next to talk about how abortion access has become easier in Virginia in recent years.
Yeah, thanks, Adele. So as mentioned, abortion is protected in Virginia in the first and second trimester. In the third trimester, there's a requirement that abortions just happen for the life or health of the pregnant person, and that 3 physicians have to sign off on that before someone can receive abortion care. Unfortunately, in Virginia, abortion is in our criminal code versus our civil code. And so there's definitely things we want to do to make progress that way, to make sure that no one is criminalized for pregnancy outcomes. But we are in a better space than a lot of states because of the protections in the code and because of all those restrictions that were repealed. But saying all that, we don't have a constitutional protection here in the Commonwealth of Virginia. And so it really is up to the political whims of the legislature and the governor to how abortion rights are protected. And so that could very much change in 2024 if we have a different legislature, because we know we have Governor Youngkin and Lieutenant Governor Sears, until 2026, unless there's something that changes nationally or something. But so I think, we need to make some electoral changes before we can make further protections. But really needing to defend against the attacks to protect our current status.
Yeah, thank you, Jamie. You brought up a really important point about protecting and then also working to enshrine that constitutional right or that right into our Constitution. So really appreciate you reiterating that. Next up, I want to throw it over to Senator Favola, then to Delegate Sullivan to talk about how abortion access has become easier in recent years, and especially when the Democrats won control of the House and the Senate.
Well, when we did have control of the House and Senate and the governorship, we removed the 24-hour waiting period. We removed the mandatory biased counseling requirement that was there. We removed the trap laws, which were totally not necessary. They governed the physical environment of our clinics, such as how wide the corridors needed to be or how many parking spaces. So we really improved access. We also made it possible for nurse practitioners to perform abortions, which is a very big deal because in many parts of our state, we simply don't have enough OBGYNs or primary care physicians or other healthcare providers. So I think we can applaud that. And I think that's an example of what can happen when people pay attention and they elect representatives who care about this issue and who care about the health of women and families. And I also want to note that in Virginia, our Medicaid program, in Virginia, our Medicaid program, like other programs in other states, will cover abortions in the case of rape, incest, or the life of the mother, which is the life of the mother is a very complicated concept. At what point does the life of the mother, does that mean the woman would be on her deathbed in the next 24 hours? Or if the abortion doesn't happen soon, she would be substantially harmed. So that's a very complicated concept, but we are following the federal framework. We do put aside state dollars, and only state dollars, to cover gross fetal abnormalities, because that's not allowed under the federal Medicaid program. We can't use Medicaid dollars, so we cover that with state dollars. And this is, I think, a very important service to provide. We're really talking about very serious, very severe cases. And in 2021, the bar is so high to reach that gross fetal abnormality that we really only had 21 abortions based on that criteria. So that gives you some sense of how serious the condition has to be. When we talk about this, women who are so significantly impacted are really low-income women who are not going to have options, and that's what bothers me immensely about this whole, abortion framework. It does not address inequalities at all. That I'm talking about the national backdrop. It's totally leftist to states, and states have not been very even or sensitive, in large part, to that inequality argument.
Yeah, so you actually hit the nail on the head, and brought up another topic that I want to dive deeper into. So that's anyone on the panel, if you want to jump in on this. What has been or will be the impact of recent and potential policies on communities of color and low-income individuals?
I just want to give a statistic. The Guttmacher Institute, in one of their reports, a recent report, had noted that 75% of abortions nationally were abortions that were sought by low-income women. And I think that's a statistic that many people really just don't realize.
And I don't think anyone, except maybe the head of our health department in Virginia, denies the fact that, and I can explain that for anyone who doesn't understand it, but denies the fact that these issues have proportionally or disproportionate impact on low-income women and women of color. It's just an undeniable statistic. And needless to say, the Dobbs decision, I mean, that was already the case, particularly here in Virginia, in terms of maternal mortality and things like that. This is just going to make that even worse. The sort of scandal I talked about has to do with the comments made by our health department director appointed by Governor Youngkin, who denied any disparity between either on an economic or an ethnic and racial basis, which is simply undeniable. And to my way of thinking, Adele, the way to think about this is where were we a mere 11 months ago here in Virginia in terms of progress being made? Barbara just went through all the things we've been able to accomplish in terms of moving the ball forward and expanding reproductive rights in Virginia. Then we have an election last November, elected a guy who only talked about abortion when in secret, wouldn't talk about it on the campaign trail, and now we're thrown immediately into this defensive posture. When I met with Barbara and I and the delegation met with the Arlington County Board, and they asked us what our top 3 priorities were for the upcoming session. My response was, well, in no particular order, my top 3 priorities are defense, defense, and defense. As far as I'm concerned, The strategy here needs to be defend what we've now have, what we've accomplished through next session, and then win the next election. That's really the only way to be certain that we'll be able to maintain Virginia as a progressive abortion state.
Absolutely, and you brought up a good point about the denial of the disparities that exist, and when you deny that, when you deny the disparities in low-income communities, in communities of color, a lot of the times that stuff goes unaddressed, and you can't properly address the root causes of that disproportionate access. And I see Jamie just unmuted and has something to say on this topic.
Yeah, if I could briefly comment about, we know that abortion restrictions disproportionately harm Black, Latinx, and Indigenous communities, people with disabilities, people in rural areas, young people, immigrants, and as we've mentioned, folks earning low incomes. And we also know that this is the direct result of historic racism, ongoing white supremacy, and coercive reproductive policies in our country. And that any effort to reduce abortion access is an effort to continue this shameful legacy. We've seen what the last year has looked like in Texas and who is getting access to care. We've seen how Black bodies are overcriminalized in this country, and we've seen who is arrested for pregnancy outcomes. And so I think we can't talk about this issue without centering those that are most impacted. And I think also acknowledging our Virginia and our country's maternal mortality rates. And so forcing somebody to be pregnant, to give birth, when giving birth is 14 times as dangerous as having an abortion, and Black women are 3 times as likely to die as a result of childbirth, is unconscionable, and that folks who are defending abortion bans should have to answer for racial disparities. And as one of our speakers at the coalition event yesterday outside the Capitol said, it is a form of gender racism that folks are blocking access to reproductive health care for millions of Americans.
Yeah, absolutely. Thank you for that, Jamie. And I want to get Dr. Danielson in to talk next about privacy protections around healthcare information in states where abortions are banned with few exceptions. People are concerned about sharing specific information about their menstrual cycle with their healthcare providers. So Dr. Danielson, is such information protected under HIPAA laws?
Oh, Dr. Danielson, could you unmute?
You would think after 2.5 years, I would figure that out. I apologize. Jamie, thank you for your comments just now. I was vigorously nodding my head in agreement with everything that you just said and the way that you said it. So thank you for stating all of that. The question about PHI is a great one, Adele. Protected health information, or PHI, that is shared by pregnant individuals or by all of us with our doctors is protected under HIPAA, period. However, there is new and urgent attention being paid to these protections since the Dobbs decision. In June of 2022, the U.S. Department of Health and Human Services Office for Civil Rights emphatically reiterated the role HIPAA plays in safeguarding protected health information for women. And in July, right after that, President Biden affirmed the protections in an executive order that called on agency leaders to protect the privacy and safety of those seeking abortion and other forms of health care. However, as you said, many women are rightly concerned about using technology and apps to track and monitor their menstrual health, their fertility, as well as similar tracking that's done by health insurance companies. And, I'm not a privacy attorney. I'm also not a technology expert, but I, like many providers, many of my obstetric colleagues, as well as psychiatry colleagues, are really counseling women to proceed very cautiously with regard to their use of this kind of technology to track information about their menstrual cycle, their pregnancy, and other healthcare information at this point.
Adele, if I might just add to what Dr. Danielson said, I'm glad to hear you say that, Doctor, because I think that's exactly the right advice. One would think that information like that would be protected. But a few Google clicks by anyone watching can find legislators around the country talking openly about trying to pass laws that would allow citizens to track one another, follow one another, people getting prosecuted or fined, or in some cases rewarded for turning someone in if they have reason to believe that someone has crossed a state line when they're having their period, or when they haven't had their period, so therefore they must be pregnant. It's scary to hear people say these things out loud. And if you'd asked me, I don't know, 5 or 6 years ago about whether such a thing could ever be possible, I would have said, of course not. But given where we are, I can't say that anymore.
Yeah.
Yeah. So speaking of crossing state lines, and I want to kind of jump into the surrounding state legislatures, the neighboring states, and some of the restrictions around there. Senator Favola, this next question is going to go to you. In a matter of months, 26 states will have implemented near total bans on access to abortion care. And that means nearly half of birthing persons in their childbearing years will not have access to abortion care. In some cases, there are no exceptions for rape and incest. So Senator Favola, can you tell us the status of access to abortion care in the states surrounding Virginia?
Thank you, Adele. That's quite a question. Well, since this is a NOVA-based forum, I will start with the state closest to this part of Virginia, Maryland. And Maryland, of course, is a very progressive state, and abortion is banned generally between 24 and 26 weeks. In other words, after 24 or 26 weeks, it's a window in there. But up to that point, the state Medicaid funds cover abortion. So they are addressing the equity issue and the inherent racial and other issues that are intertwined when women don't have access to funds and therefore don't have access to this important service. And they also removed a lot of regulations, and private insurance plans are required to cover abortion in Maryland. So that's Maryland. West Virginia, there is an abortion ban at 22 weeks and later. Patients are forced to wait 24 hours. And the state constitution in West Virginia explicitly excludes abortion rights. So we're expecting that more restrictions will come out of West Virginia. At least that seems to be the path that's the legislature's going down. Kentucky is probably the most restrictive of the states that touch on Virginia. It is abortions in Kentucky are completely banned. There are limited exceptions, and patients must make 2 trips, one in person for counseling, and then at least 24-hour waiting period after that. But the ban is extraordinarily restrictive. Abortion policies in Tennessee are banned. In other words, abortions are banned in Tennessee, again, with very few exceptions. So that's Kentucky and Tennessee. And North Carolina, abortions are legal up to 20 weeks. So there are various laws and regulations in play in the states around us. But Virginia certainly would be considered one of the safe haven states in the South. And the issue for us is whether our clinics can handle this influx. And part of advocacy is not only working to change the laws and to get the right people elected, it's also, I believe, helping to fund groups like Planned Parenthood and other clinics that need dollars to really serve women who need abortions. And again, it's safer for the woman if the abortion is timely. In other words, the woman doesn't have to wait weeks to receive that abortion. So there are a lot of threads going through this backdrop of state legislatures getting in the middle of these very personal and private healthcare decisions. This is no place for government at all. And I try to keep reminding our friends on the other side of the aisle who purport to be advocates of limited government that this is not the place for politicians to be making decisions for women and families. It's challenging. And of course, the other whole conversation evolves around the medication-based abortions, which more than half of the abortions now nationally are done with medication. And I don't know where that issue is eventually going to shake out, because states are taking different perspectives on it. But again, the interstate commerce is a federal issue. And the Biden administration is working very hard to keep access to medicated abortion pills and other pharmaceuticals available.
Delegate Sullivan, did you have something on that note?
Well, sure. I'll sort of put my lawyer hat on here for a second, which is I have two jobs, of course. My real world job is as a lawyer. My unreal world job is as a legislator. But they often intersect, of course. Anyone who thought that the Dobbs decision was going to reduce the amount of litigation over abortion issues in the United States was, I think, will be woefully disappointed, because there's just going to be a slew of litigation having to do with individual state decisions. And particularly the reason I unmuted was in the area that Barbara's talking about, because she's right. The Biden administration is pulling every lever it can think of, and certainly taking the position that federal rules that the FDA has issued about the efficacy of abortion-inducing medication take precedent over state rules. That is far from settled, and is going to be a huge battle in the courts. And there was this little boomlet in the wake of the Dobbs decision, which I think was rooted in a lot of anxiety, obviously, about what had happened, and grasping for things, ways to try to get around it. And there was this little boomlet of folks talking about, women will just be able to, women in states where these restrictions get put into place will just be able to get abortion pills in the mail. And so they'll be able to work their way around that. Well, there are states literally talking about ways to stop that. But more importantly, the question becomes, can a state ban mailed in, and what risk would there be for physicians to send medication from one state into another state? And you can get really weird scenarios that you could think about, which would be, physician A who lives in a state or country that allows abortion, sends medication into Kentucky, which bans abortions. That physician would be a great legal risk, and certainly, my advice to them as a lawyer would be, you better never go to Kentucky again, on vacation or otherwise, or you just might get arrested. So the Biden administration is taking that position. It's going to be clearly going to have to be litigated. My guess is Jamie can shed a lot more light on this than I, but Barbara's right about the proportion of abortions that are using medication these days. But it's not clear to me as a lawyer or as a legislator that that's a panacea that's going to solve this problem, because it's rife with legal issues.
Yeah, thank you, Delegate Sullivan. And Dr. Danielson, I want to pivot over to you and pivot the discussion to talk about mental health. How is the national conversation about restricting access to family planning services and abortion care affecting the mental health of folks?
Well, I think before the Dobbs decision, our nation was already experiencing a mental health crisis that was disproportionately affecting women, mothers, parents, and children. The COVID pandemic and the impact on parents and families with young children, gun violence in schools, cost of childcare, absence of paid parental leave, a formula shortage, now the loss of this right. I mean, we could really go on and on. And I will say that, you know, for the past 20 years, most of the work that I've been doing is providing mental health care for pregnant and postpartum individuals. And what we know is that mental health conditions like depression and anxiety are the leading complication of pregnancy. So if we take for just a moment, if we take reproductive autonomy and reproductive choice sort of out of the equation for a moment, we know that conditions like depression, anxiety, and PTSD in pregnancy are not only the leading complication of pregnancy, they affect about 1 in 5 women who are pregnant, and that these conditions pose significant risks to the mother and the fetus. They impact a woman's ability to care for herself, her ability to function as a parent, her ability to bond and attach to her baby. And we know if these conditions are untreated, they create significant disruptions in the normal development of that child and are associated with all kinds of problems over that child's lifespan. And this science is not debated and it's not limited. We also know that the most devastating risk of untreated maternal depression is the death of the mother, and that suicide and overdose from drugs and alcohol are the leading cause of death in the first year postpartum. And so I point out these statistics because we know that women that encounter a forced pregnancy or must give birth in a state where abortion access is limited or it's altogether absent, that it follows that rates of perinatal depression and all of the associated morbidity and mortality is going to increase among those mothers and the negative consequences for her children and her surrounding family.
Could we move to, Adele, could you walk us through some of the questions in the chat room? Because I don't want to go too much over our 7 o'clock, although we did start late, so we certainly can.
Yeah,
7:15.
There was a question that I believe Delegate Sullivan halfway answered. So we'll not ask that part of the question, but they did ask about, is there any talk coming down the pike of restricting access to contraception in Virginia at this time?
Yes.
Yeah.
The Dobbs decision itself talks about, through Justice Thomas, in his concurring opinion, talks about his belief, and I don't think he's alone, that the Supreme Court needs to revisit other decisions based on the same sorts of legal rationale that Roe was, and that includes the decision, the Griswold decision out of Connecticut many, many, many years ago. That, if you can believe it, a court case was required to make clear that couples had a right, people had a right to use contraception. We should not kid ourselves, and neither should we believe at least some people on the other side when they try to assure us that the right to contraception, or for that matter, it's not the topic of this forum, but same-sex marriage, that those rights are off limits. No one's going to go after them. I don't believe them. And as a lawyer, again, I can tell you that the rationale used by the Supreme Court could be used to take away rights to contraception. And there's no reason to believe that the Republicans in Virginia would somehow be different than Republicans elsewhere that are talking openly about this sort of thing.
I will just say there is a lawmaker in the Senate who has already filed a bill that basically would identify life at the point of inception. So I think Delegate Sullivan's right. We are going to see a range of all the draconian bills that have been introduced in other states will be introduced in the Virginia General Assembly. Now, we do have a Democratic majority in the state Senate, and those bills will go through the Ed and Health Committee, where we do have a healthy majority of Democrats on that committee, and we will defeat those bills. But it'll be a very, frightening conversation. It'll, especially given the backdrop of the national context and the states around us. So I think we are not immune. And I think that was the point that Delegate Sullivan was making.
Yeah, absolutely. And Senator Favola, on that note, someone in the audience had asked about being able to speak about abortion and the specifics in a very straightforward and simple way. So, Jamie, can you kind of speak to that, and maybe what resources that folks in the audience can get to speak about this and to advocate for abortion access?
Yeah, happy to do so. As I mentioned, really talking about how abortion is a personal decision between the pregnant person and their medical provider, and then whoever they love and trust, whether that's additional family, whether that's their faith leaders, other community leaders, other people in their lives, and, really wanting to center the pregnant person in this decision. So, it's not about, it shouldn't be about what legislators, what politicians, want to arbitrarily decide. It should be about what is best for their health. Abortion is healthcare. And so making sure people have access to, the full spectrum of reproductive health care, because we know that pregnancy is complicated. And so, people needing to be able to make decisions that are best for them. And I do want to just address, Delegate Sullivan brought up earlier, some of the misinformation that was shared by legislators yesterday. And I think it's really important that we call out misinformation and that we say, these claims are blatantly false. These claims are pushed by anti-abortion activists in order to scare people and stigmatize reproductive health care. So there's various legislation that's been introduced. Delegate Freitas often introduces legislation where it's very clear. The whole goal is to make, a show and to really try to stigmatize healthcare, and talk about, make it sound like people are, accessing that, waiting till later in pregnancy to decide, where really what we know is happening is that, one, people don't have the access that they need, and that delays people getting access to abortion care, whether it's other state restrictions. Also, we know people don't have financing because their health insurance doesn't necessarily cover the care and access they need. We also know that people often get really tragic diagnoses later in pregnancy. We know for folks who haven't been pregnant might not know, how much as a pregnant person you think about that 20-week anatomy scan where they're going in. And I had my daughter about 19 months ago. And so, thinking about those points in pregnancy where you learn new information. And so oftentimes in these situations that they're trying to make into these, theatrical shows, it's people getting really tragic information later in pregnancy, whether it's, a non-viable pregnancy or it's a maternal health diagnosis. And one of the things that being in this role, I have lots of people tell me their personal stories, which is beautiful, but also really heartbreaking. When you hear personal stories, there's a woman who testified last year against the 20-week abortion ban, and she told her story about she had a child and then she was pregnant with her second child. She went to that 20-week anatomy scan and found out that was a non-viable pregnancy. She was not going to have a healthy baby as a result of that pregnancy. I forget the exact medical condition. And what she thought about is, how do I make sure I can, one, return home safely for my child at home. And, I'm in my 30s. I want to have a second child. How do I also not miss my window to have, to expand my family? And so I think when we're talking about this issue, really centering individuals who are impacted, and really calling out just the BS and misinformation that other side, they want to ban abortion. And so they're going to try to stigmatize this care as much as they can.
And not to put too fine a point on it, but the not so subtle implication when someone like Delegate Brewer talks about abortion up until birth or through birth is that there are legions of women deciding as they're giving birth, I don't really want this baby, and then they kill it.
That doesn't happen.
That never happens.
No.
The people that are facing the decision that Jamie's talking about are people who wanted to be pregnant, are happy to have been pregnant, and then get devastating news. Just absolutely devastating news. And here you've got families making decisions that are just excruciating, akin at the other end of life to when an old person is terribly ill, and you have to make some decisions about resuscitation and things like that. And look, we have to. I love Ralph Northam, but he gave a pretty clumsy answer to a question once, and it's being used against us regularly. Yeah. He was describing a situation that was a tragedy, and with a fetus that was going to die or had died, and it's being twisted by the other side in gruesome ways. And I think Jamie and Barbara, from a political perspective, will agree with me that they're just lying about what's really happening out there in order to scare people. I get the question all the time. Rip, you're a Democrat. You're in charge. You're in favor of infanticide. And that's the root of that charge. And we need to push back. I saw that question in the Q&A. What can we say? We need to push back and talk about, no, you are looking at this the wrong way. These are families dealing with the most excruciating information you could ever imagine.
Very
excruciating. And having to make decisions that none of us would ever want to make. And sure as heck, the government shouldn't be making.
And two doctors, the opinions of two doctors are required.
Yeah, this is not a willy-nilly decision that a woman
very
gets.
Late stage abortions. Yeah, you are absolutely correct. Those are heartbreaking decisions.
And I mean, I think I'm again nodding that fewer than 1% of abortions occur after 22 weeks. So we're talking about very few abortions. And when you think about the psychology of a pregnant woman, the misrepresentation that this decision is made glibly, it's made reactively, that in fact we know that women have abortions because they have great respect for the responsibility of motherhood, that they feel that the decision to continue their pregnancy should take into account the effect of their existing responsibilities, that they should give birth when they've maximized their social and financial resources, that women are making this decision because of poverty, because of a lack of social support, because of domestic violence, rape, and incest, a wish to, establish their careers or complete their education. That this idea that women would want to, enjoy sex without wanting to take on the responsibility of motherhood, or that they don't desire or respect motherhood, I think is part of the misinformation that just justifies restrictive legislation everywhere.
Thank you, Dr. Danielson. And we only have a couple more minutes, so I'm going to take one more question from the audience, and then we'll wrap up. There's a question about access to free medical health and contraception for all women, and they'd like an update on the situation for that particular effort.
I can speak to that some. So one, yes, everyone should have access to full range of reproductive health care. And Virginia has a program called the Contraceptive Access Initiative that provides free, no cost birth control from long-acting reversible contraceptives like IUDs and implants to birth control pills for Virginians who are up to about 250% of the federal poverty level. And that is paid for using TANF funds here in the Commonwealth. And there's 18 participating providers across the Commonwealth that participate in that program. And so I think that was a program started under Governor Northam that has continued. That's really important to, making sure that Virginia continues to fund access for contraceptives for those that cannot afford access or do not have health insurance to cover that. Also, the Obamacare and the Affordable Care Act greatly expanded access to contraceptives, but that's something that we need to make sure that we protect here in the Commonwealth, and that I think could be under threat, as Delegate Sullivan and Senator Favola mentioned.
Thank you, Jamie. And to wrap up, and then I'll send it to Senator Favola at the end. But just to kind of throw this question out to the panelists, what specific actions can we take now to keep Virginia a state that allows abortions? And then if anyone also wants to plug any resources that are out there that folks in the audience can support.
Adele, I want to speak to at least your first question on sort of advocacy and how do we get the word out. There was a question in the chat room, I believe, that dealt with religion and the fact that some religions do not ban abortion or birth control in the way that the Catholic faith does. And people have come to me and said, in my faith, abortion is recognized as health care, and the decision is left to the woman. There is no, religious rule, if you will, governing access to abortion. We are a multifaceted country, and we do have many religions in our country, and the practice of religion is a personal thing. It is held sacred, used to be. And so there are some faith communities that are actually organizing to say, wait a minute, we don't want to be under the rule of a more Christian focused law. We feel that the a ban on abortion actually would violate the practice of certain faiths. So that's an interesting, that has come up. That is an interesting question. I do think it is a very legitimate question. I think it's going to have to be determined in the courts, as Delegate Sullivan said. But there are some advocacy groups, the Jewish community in particular is organizing and saying, wait a minute, I don't want my religious freedom impinged upon because of this Christian Catholic framework that seems to be underpinning the abortion laws that are passing. So I'd like to go back to, and I know this is not exactly a good analogy, but it's a good analogy, but it's the Medicaid expansion effort. We had a broad-based group of faith communities that really argued about the importance and the value of expanding healthcare. And I thought that voice was very effective. So I will just say that. I know Jamie's nodding. She probably has more experience than I just shared on that whole advocacy effort, but I just wanted to put that out there.
Delegate Sullivan.
I was just gonna put my political organizing hat back on. I think you asked Adele about what we can do, and I know there was I think it was Kate asked in the chat room, what are we doing to try to make sure this doesn't happen in Virginia, or what do we do if it does happen in Virginia? And the answer, as I said earlier, politics, legislating is all about simple arithmetic and counting votes, and we just need to win elections. And what happened in Kansas is encouraging. The polling that we've seen post-Dobbs is encouraging. Women and the men who support them are getting active. We shouldn't kid ourselves. This is also energizing the other side, but we need to be more energized and get to the polls whenever and wherever we can. And the next opportunity to do that, well, first will be this November in just about 8 weeks on the national basis. So go out and help Abigail and help Elaine and help Jennifer, so we can keep the House in Congress. And then Election Day is November 8th. On November 9th, we turn our attention to Virginia and the state elections that are next year. Barbara will be on the ballot. I'll be on the ballot. We need the House back. We need to expand our majority in the Senate so that we're not hanging by this one vote thread on giving certain people too much leverage. So no rest for the weary, and that's how we keep this from happening, is that we win elections.
And I just want to note, the only way we will get a constitutional amendment to the voters of Virginia is if we have the right people in the House of Delegates and the state Senate who are able to pass the language for the referendum question. We don't need the governor. So on a referendum question for our state constitutional amendment, we just have to have it pass both chambers 2 consecutive years without a change, and an election in the middle. Once that happens, we can put it before the voters. It does not go to the governor. So we can do this sooner than you might think. And a constitutional amendment will really be our only permanent protection. But again, it depends on the election. So I know that all you out there have, you're savvy, you've been involved, you have helped fund campaigns, you have knocked on doors, you have written postcards. I know I've gone to many parties where we are donating to our clinics in the Commonwealth, the Planned Parenthood clinics and other clinics that provide abortion care, so women who need that care can get it. Thank you. You have been wonderful in all of those efforts. I'm sorry I have to ask you to do more, but it never ends. So it's my final word.
Thank you, Senator Favola. And we're actually out of time. Appreciate you all being here with us tonight. Delegate Sullivan, I think you may have a word, and then I'll pass it right back to Senator Favola to send us home.
Well, like Barbara, thank you everyone for being here. Thank you for what you've done in the past. We need to channel our anxiety into action. All of us are, I think, I don't see any overreaction here. No, it's impossible to overreact. This is an enormously important issue we've just taken a real gut punch, and I don't know how many people following the chat room, but take a look at, apropos my earlier conversation about what's happening in parts of the state. Take a look at the chat room. My old friend David Turetsky weighed in with a story about people out there who are trying to subpoena women's search records, internet search records, to see if they've been searching for how to cause an abortion or what to take to cause a miscarriage. This is really scary stuff. But we can't get scared and go inward. We need to take that anxiety and that well, I'll say fear, and channel it positively, and win elections. Contact your legislators, anyone who's on the fence, we need to make sure he or she's on the right side. This is a real call to action. And I'm hoping that in some short amount of time, this disaster of Dobbs will be able to look back at it and say that it was the catalyst for real change, which would be, as Barbara's talking about, constitutional amendments, the right people being elected for long periods of time, so that we can put an end to this once and for all. So that's what we need to do, is we need to somehow turn Dobbs into a positive.
We will happy to provide answers to any of the questions that came up in the chat that we have not responded to. I will prepare responses and try to get them out to folks. So Julia, I hope you can sort of capture the questions, and I'm sure we will have emails for those who have asked the questions, and we'll get you answers. So thank you all. Adele, you were a wonderful moderator. Panelists were wonderful. Dr. Danielson, thank you. Aimee Lockhart with Planned Parenthood, thank you very much. My colleague, Rip Sullivan, you were insightful. I thank you. And again, I do want to thank Patrick Hope in absentia, because he is certainly with us in spirit and has been a good fighter for us. And I want to thank my team, Julia Chun and Jacqueline Nguyen, for putting this together. So I hope you all have a wonderful evening, and we will continue to be in touch.